Welcome to Young Asia Television.
Presented by the National Science Foundation of Sri Lanka.
Did you know that smiling and laughter can help relieve stress, lower blood pressure, and even prevent certain diseases? An attractive smile can even boost your self-confidence and bring a greater quality of life. Now, isn't that reason enough to make you want to smile? If you want to have a healthy smile, it's important to practice good oral hygiene and make regular visits to a dentist. Today's program will take a look at the importance of our teeth and oral hygiene. This program will also highlight some common oral health problems which can be easily prevented. Stay tuned.
පනනල ඇත සුරකී ජීවිතයේ විදුනන අත්තර ගත යුත්තේ අවනි පැයුම් විහිවිය යුත්තේ සොපාදහම් සුරකිය යුත්තේ අප සම නිරෝගී විය යුත්තේ ජීවිතයේ මේ සියලු රහස් ගැන දැනුවත් විය යුත්තේ විද්‍යාවෙන් තේරුම්ගෙන ලෝකය ජීවත් විය යුත්තේ
Our teeth help us chew and digest food and play an important role in speech and maintaining facial dimensions. But most of us take our teeth for granted until something goes wrong. How much do you really know about your teeth and oral hygiene? Today's program will help you brush up on your knowledge. Both in its Latin root and in common usage, the term oral refers to the mouth. The mouth is an important sensory organ in the craniofacial area, which houses the eyes, the ears, the nose, and the tongue. The human body cannot function without the mouth, mainly as the process of digestion begins here. In the mouth, food is chewed and broken down into small pieces. The saliva here contains the enzyme amylase, which helps in the digestion of carbohydrates. The mouth is also important for us to communicate with one another, as the tongue, teeth, lips, and palate play a major role in helping us to vocalize our thoughts and feelings. Maintaining oral hygiene has an overall bearing on not just a person's physical well-being, but also has an impact on our self-confidence, our social interactions, and the image that we present of ourselves in public.
We know for a man to live healthy, it is not only the physical dimension that he should maintain. He should be healthy socially, mentally, and spiritually. If a man does not maintain a good oral health, if he is full of diseases in the mouth, not only physical, but his mental health can be affected. He cannot go to the work, he cannot go to schools, and he cannot concentrate in any event. So that his mental health is affected, social health is affected. If he has a bad breath, definitely the social interaction is affected. If he is in pain, his social interaction is affected. Not only that, he himself cannot look into his own mind. spiritually he is not stable. So that oral health is very much important for a total health.
Every human being begins life with a single cell. The first stage of tooth development begins in the fetus at about 6 weeks of age, when the basic substance of the tooth is formed. Thereafter, following around 3 to 4 months of gestation, the hard tissue that surrounds the teeth is formed. The mother's nutrition, including proper calcium, phosphorus, and vitamin A, C, and D intake during pregnancy, ensures proper teeth development of the child. Even during the post-pregnancy stages, maternal oral health is found to have a significant impact on the oral health of the infant.
When the child is delivered, after the birth of the child, it is the mother who always be with the child, maybe hugging or rearing, anything, feeding. The mother can transmit bacteria from her mouth to the child's mouth. When the child is born, the child's mouth doesn't have any bacteria, but the mother transmits. So that if the mother can regulate, control the amount of bacteria in her mouth, invariably she will transmit lesser amount of bacteria to the child. So that the mother, she should ensure if there are decayed teeth, she has to get those filled before the delivery, and if there are decayed teeth which cannot be filled, she has to get those extracted. And morning and before going to the bed, she should brush her teeth very well, so that she should control the amount of bacteria in her dental plaque in the mouth.
When an infant is born, there are no visible signs of teeth, as human babies can draw sustenance exclusively from breast milk until the age of 6 months. At around 6 months of age, the primary teeth or milk teeth begin erupting through the gums, allowing the infant to begin chewing on solid foods. The first milk tooth to erupt is usually a middle front tooth on the lower jaw, known as the central incisor. At the age of 2.5 years, a child has 20 milk teeth or deciduous teeth. The jaws, the upper known as maxilla and the lower known as mandible, each contain 10 teeth. There is normally a space between permanent teeth to leave room for the larger permanent teeth to erupt as the child develops. Starting around the age of 6, these primary teeth begin falling off and are gradually replaced by permanent teeth. The average adult has 32 teeth, 16 in each jaw. However, this can vary from person to person, with some mouths having only 28 teeth.
The biggest problem during that transitional period is that the permanent teeth which erupt into the mouth in place of the exfoliated deciduous of the milk tooth is big. That is because the permanent tooth erupts into the mouth in the fully developed form. The teeth cannot develop thereafter. They are already fully developed. So it is a big tooth because the tooth is for an adult phase. But during that period, the face is still a small face, for a child face.
There are 4 different types of teeth in the mouth: 8 incisors, 4 canines, 8 premolars, and 12 molars. The 8 flat linear teeth in the center, known as incisor teeth, are used for cutting and shearing food into small chewable pieces. Incisor teeth also help us to smile, pronounce certain sounds, and maintain facial height. Adjacent are conical shaped teeth called canines, which are mainly the anchor teeth in the jaw. The 4 canine teeth are used for tearing food and also give a unique shape to the face. The 8 premolar teeth and 12 molar teeth in the back of the jaw are used to chop, chew, and grind hard food particles. The molar teeth comprise of 4 wisdom teeth that usually take a longer period to emerge than the other teeth. Wisdom teeth generally erupt between the ages of 17 to 21. The 4 types of teeth in our mouth are different in shape and size, each serving a specific purpose. Next, let's take a look at the anatomy of our teeth. All 4 tooth types are embedded in the jawbone and have the same basic structure. The visible part of the tooth is known as the crown, and the part embedded in the jawbone is known as the root. Incisor teeth have only one root, whereas molar teeth have either 2 or 3 roots. The outer calcified tissue layer covering the crown of the tooth is known as enamel, which is the hardest substance in the body. The inner tissue layer that lies beneath the enamel is known as dentine. The center part of the tooth that consists of blood vessels and nerves that enter the tooth from a hole at the bottom of the root is known as dental pulp. Gum tissue or gingiva is the soft tissue covering the necks of the teeth. Taking care of our teeth is important as they are susceptible to tooth decay, which is a common problem around the world. Did you know that nearly 50 to 60% of children in Sri Lanka at the age of 6 suffer from dental caries, also known as tooth decay or cavities? 22% of people aged 65 don't have even a single tooth. And 12.9% of cancers in Sri Lanka are oral cancers. The statistics are quite worrying. Improper dental hygiene and food habits and negligence must be addressed in order to turn these statistics around.
The most prevalent oral disease we can see at any age is the dental caries or tooth decay. Starting from the first year of life, the child at risk for dental caries develops dental caries or tooth decay. As an average, if you take a 6-year-old may have 4 teeth decayed, and this gradually increases, and when a man comes to the 35th or the 40th age, we see at least about 8 to 9 teeth are affected by dental caries as an average, and more than 90% of the population at that age are affected by dental caries.
Dental caries or tooth decay occurs when the acids formed in your mouth as a result of eating sugary substances dissolve the outer layers of your teeth. Your mouth is full of bacteria, which combined with small food particles and saliva to form a sticky, invisible film known as dental plaque, which builds up on your teeth. When you consume food or beverages that are high in sugar and refined carbohydrates, the bacteria in dental plaque consumes the carbohydrates for their energy needs, producing acid in the process. Over time, the acid in plaque begins to break down the surface of your tooth to create a cavity. Once cavities have formed in the enamel, the plaque and bacteria can reach the dentine. As the dentine is softer than the enamel, the process of tooth decay speeds up. Without treatment, plaque and bacteria will enter the pulp. At this stage, your nerves will be exposed to bacteria, making your tooth very painful. If you experience toothache, pain when eating and drinking, visibly discolored spots on your teeth, the lodging of food particles on the tooth surface, and an unpleasant taste in your mouth, it's high time for you to visit your dentist. The second most prevalent oral disease among the elderly in the country is periodontal disease or gum disease. Research has shown that untreated gum diseases can lead to diabetes, cardiac disease, and even premature birth. It's important to find out how this disease is caused. Let's take a look. Gum disease is a common condition where the gums become swollen, sore, or infected. Gum disease is not always painful, and you may not even be aware that you are afflicted by it.
The normal, healthy gum tissue or the gingiva is pinkish in color. In Sri Lanka, if you take, the people have dark skin, so that your gum or the gingiva may not be pink, but it may be either purple or black. There is a nice scallop edge in the gum tissue along the margin of the teeth. And this gingiva, the gum tissue, does not bleed when you touch with your finger or with the bristle of a brush.
Gum disease can be caused by a number of factors. However, poor oral hygiene is seen as the most common cause. Not brushing your teeth in a proper and regular manner can cause plaque to build up on your teeth. Plaque contains many types of bacteria that can contribute to gum disease. The initial symptoms of gum disease can include red, swollen, and bleeding gums after brushing or flossing your teeth. This stage of gum disease is called gingivitis. If gingivitis is left untreated, the tissues and bone that support the teeth can also become affected. This is known as periodontitis, with the symptoms including bad breath, an unpleasant taste in the mouth, receding gums exposing the roots of the teeth, loosening of teeth, and gum abscesses. In periodontitis, plaque spreads and grows below the gum line. The bone in your jaw can degenerate and small spaces can open up between the gum and the teeth. Your teeth can become loose and may eventually fall out. Other factors that lead to gum disease include genetic predisposition, smoking and tobacco use, malnutrition, stress, overuse of medication, and aging. Oral cancer is another serious health issue which is steadily on the rise in Sri Lanka. It's reported that 2 to 3 persons die of oral cancer every day. In Sri Lanka, oral cancer is the commonest form of cancer found among men and the third common cancer among women. Oral cancer develops on the surface of the tongue, mouth, lips, or gums and is mainly caused by chewing betel and tobacco, smoking, and heavy consumption of alcohol. Non-healing mouth ulcers, red or red and white patches on the linings of the mouth or tongue, and a swelling of the mouth that lasts for more than 3 weeks, difficulty in consuming spicy food, and difficulty in opening the mouth are some of the early signs of the oral premalignancy disorder which may lead to oral cancer. In most cases, oral health issues are caused by lifestyle habits and the lack of adequate care and attention. Most of these issues can be easily prevented. However, there are some cases where oral health issues are caused by certain anomalies which require surgical intervention. Malocclusion occurs when the teeth or jaw does not develop in the normal way. The abnormal alignment of teeth and disproportionate jaw relationship cause discomfort and make it hard to maintain good oral hygiene. Various such dental anomalies have been detected in nearly 15% of the child population in Sri Lanka. Malocclusion may require orthodontic and sometimes surgical treatment to correct the problem. Orthodontic treatment involves the design and use of corrective appliances such as braces, plates, and functional appliances to bring the teeth and jaws into proper alignment. Certain factors in our environment, such as excessive amounts of fluoride in water sources, can also lead to oral issues, such as dental fluorosis. Dental fluorosis is a condition caused by overexposure to fluoride during childhood. Frequently detected in areas such as Anuradhapura, Tambuttegama, Kakirava, Kurunegala, Raswehera, Vaunia, and Polonnaruwa, where excessive levels of fluoride is present in sources of groundwater.
When you drink groundwater with fluoride, during the developmental stages of the teeth, more fluoride can go into the tooth and tooth structure can change. The symptoms are the teeth have brown spots, and if the fluoride content is more, then of course the tooth starts pitting or some damages to the enamel, and ultimately tooth structure can change.
The 3 most common oral diseases in the country, dental caries, gum disease, and oral cancer, can be prevented through one behavioral change, by developing good oral hygiene habits. Let's find out how this can be done.
The main reason for dental caries, if you take, is the food. We said it is a behavioral disease, so that to reduce dental caries or to prevent tooth decay, one has to do certain things. Number 1, you have to control sugar in food. It does not mean that you have to prevent or you have to avoid sugar, but ensure that between any 2 events of sugar, at least there is a 2-hour gap. Second one is brushing. One has to at least clean his teeth twice daily, morning and before you go to bed, so that the proper toothbrushing can reduce the amount of bacteria, and that reduces the risk of dental caries and gum disease. Number 3, if one brushes his teeth, the best way of brushing his teeth with fluoride toothpaste. Fluoride can reduce the risk of acid dissolution or dental caries or tooth decay. On the other hand, just like chlorine is added to the water, it destroys bacteria. Fluoride also, because the fluorine and chlorine are both in the same family. So fluoride also can reduce the bacterial action. If you are a child, show your mouth to an adult. If you are adult or adolescent, look into the mirror and look at your tooth tissues, tooth, the cheeks and the skin of the mouth. And if you chew betel or if you consume alcohol, if you smoke, think that you are at risk for oral cancer or orally pre-malignant disorders. So you have to gradually reduce taking areca nut, tobacco or smoking or alcohol.
The health of your mouth mirrors the condition of your body as a whole. Therefore, through proper awareness of oral hygiene, like brushing twice daily in a proper manner, reducing sugar intake and frequency, and scheduling regular visits to the dentist, you can maintain a healthy mouth and a healthy smile. Well, it's time to wrap up this episode of Mihimadala. Thanks for watching.